Hello, my name is Heather Hirsch, and I'm an environmental health specialist from the Arkansas Department of Health. I'm here to speak with you, the future pediatricians of America, about exposures and injuries children often encounter or are at risk for. I know you all want to become pediatricians later in life. It's important to get an understanding of the patient population you will encounter. In this presentation, I will discuss the importance of studying and treating children separately from adults. I will also briefly introduce some of the common childhood exposures and injuries in the pediatric population. I will elaborate on this in greater detail during my next presentation. First, we will look at what makes kids so special. We know that they are not just miniature adults, that they are actually a special population that requires its own field of medicine and study termed pediatrics. Children are still growing, and not just in height, but in their internal organs. They're developing their physical bodies, their brains, and their immune system. Because they are not fully developed, they do not have the immune system or the body's defense mechanisms that adults do. Because of this, they do not have the same mechanisms of absorption, distribution, metabolism, and elimination of environmental contaminants that an adult has. So it could take a smaller dose of a toxin or less time to have an effect on a child. They could also have worse outcomes from the same environmental contaminant as an adult was exposed to. Also, children consume food and water than adults, so they are exposed to those sources of potential hazards more than an adult. And thinking about behaviors, we have to think about the curious mind of a child. A child is crawling and practicing increased hand-to-mouth ingestion when they are very young, and this makes them vulnerable to greater exposures by certain contaminants within those environments. They could eat dirt or household dust or anything that seems appealing to them, which is not food, so this would be pica-like behaviors that could be dangerous. Children are curious, and this could lead to them encountering dangerous household products such as cleaning supplies or medicines. They could also mess with tools and equipment causing injuries. As a child is older and begins to take care of their own hygiene, they might not be doing a great job, which could allow them to spread germs because they're not washing their hands or their bodies as well as they should be, and they might not be brushing their teeth either. So these could lead to other medical consequences and dental consequences as well. And then lastly, thinking about social factors, this has a large tie into what we've already discussed. Young children who have vulnerable immune systems can easily catch or spread illnesses amongst each other at daycares and schools. And even older children and adolescents can easily spread diseases or encounter the same hazards when they are in sports teams and in larger groups. The additional factor of peer pressure can lead children and adolescents to pursue risky behaviors that can lead to injuries. For example, teens can be persuaded to do drugs or alcohol or inhale or drink hazardous chemicals or to do risky pranks. They can all have bad outcomes. A child's brain is still developing, so they are more open to suggestion and have less capabilities to avoid temptation and peer pressures than adults. This makes them a high-risk population. Okay, some common pediatric exposures and injuries. First, we'll look at the exposures. So we can think about these in terms of indoor hazards and outdoor hazards. Common exposures that are indoors can be related to the residential homes. So we have lead, radon, pesticides, and tobacco smoke that could be present. We will go into greater detail about these effects later. And then molds or some kind of consumer and building products that have chemicals in them that can be dangerous, and cleaning supplies like we previously discussed. Also, outdoor hazards could be considered air pollution, which affects everyone, but it could affect children at a greater level when we talked about the rates of metabolism and absorption and those things. And then allergens, so seasonal allergies and other factors that could lead to asthma. We know that kids have way higher rates of asthma in current ages than they did in the past, and it could be due to the outdoor environment. Also playgrounds, something we discussed with pica is, eating the dirt, licking things, stuff like that. There's just germs and hazards and potential chemicals that could be on playground equipment. All of these could be bad. And then looking at injuries, We know that there are some serious injuries that can occur. The CDC says that in all age groups of people 1 through 44 in the US, that the most common death is from unintentional injuries. So one of the most common unintentional deaths from unintentional injuries is motor vehicle accidents. Although children are not the cause of the accidents, they are more vulnerable during a motor vehicle accident, especially if they don't have a proper car seat or seat belt or something like that. And what we talked about, their physical bodies and internal bodies, they're more at risk for harm than an adult would be. Also, drowning is high on the list, and that can happen easily in young children who don't know how to swim, or if you're swimming in unsafe areas, anything like that. And then looking at infancy, specifically before 12 months, babies are at risk for unintentional suffocation that could be related to their sleep environment. If they're co-sleeping with their parent, or they're not in a crib, like a safe sleep environment, they could, accidentally suffocate and not be able to breathe. Also, shaken baby syndrome can occur when a baby is shaken very hard, aggressively. It could cause traumatic brain injury. And then we also talked a little bit about unintentional poisoning with the chemicals and children accidentally getting their hands on those types of things that can cause serious harm. And then unintentional firearm injuries are something that isn't discussed very much, but it is really important, and it's a very high cause of death from children accidentally getting a hold of guns or weapons and playing with them, and somehow they get themselves hurt or hurt other people. And then a big issue as well with children is their use of skateboards and bikes and things like that. And if they're not wearing helmets, or if something else happens, they could fall and somehow end up with a traumatic brain injury or anything of that nature. And so we'll go into more detail about these things in the coming slides. I just wanted to kind of give you a preview of some of the common exposures and injuries that you have to really be looking out for kids, especially because they are affected more by these things, either in the rates of how they're excreting them from the body or just being exposed to them more. So it's really important to think about, and we'll discuss it further. Here are the references that I used to come up with this presentation.